The health system, whether it's the health leadership, whether it's the technocrats, cannot do anything if they do not have the financial backing. So we need to find out first how much money has been put into the budget for 2024 to fund health. That's a key question. And so that tells you what is the thinking of government. And I've got the approval document from the Health Select Committee. I don't know if you have it, but do you realize that in 2024, the whole financial year, what was approved for, for health is 15,577,237,278 Ghana cedis. That was what was approved. If you divide that, because when you see a lot of money like that, you would say that, well, it's a lot of money because almost 15.6 billion is a lot of money. But to get the real impact that that money can make, you have to put it into a quantifiable sum. How much money is spent per person per year by this government, or how much is the government intending to spend per person per year in health? If you look at our projected growth rate of about 2.1% per annum, as based on the statistical service, and you do the numbers, you realize that the government has committed to spend about $37 to $38 per person per year on every Ghanaian. That's all the government is committing to spend. That includes any inflows that will come out of NHIS. It includes any capital expenditure that would go into building new hospitals. It includes things that would be used to buy new equipment from these consultation rooms. And to put that in context, if you look at Ghana's global health expenditure per capita, which has been dropping since 2020, we were at around $71 last year. Out of that, the government was contributing just around $30. The private sector, which means out of pocket, you are paying out of your pocket, even though there's a health insurance scheme, was contributing 50% of that sum. So they were contributing about $36 of that sum. The remainder was being contributed by our development partners. If you look at the fact that in the 2020 budget, when the government was committing about $29, $30, what was actually approved for the government to spend was about $42 per person per year. So you have to realize that what is approved is not the same as what is dispersed.
Right.
You need to understand that of this $37, $38 per person per year, the government is going to end up spending around $26, $27. What does that mean? It means that citizens would continually have to pay more to procure health. So our health expenditure, the 50% component that is paid by citizens, is likely to go up because the government is not paying up. And you then have to look at it and say, well, in a country where we have committed to deliver universal health coverage by 2030, because this is something we signed up in 2015 to do. And what does universal health coverage mean? It means that you deliver healthcare to the individual free at the point of use. It doesn't mean the healthcare is not paid for, but what it means is that finance should not be a constraint when you go to access healthcare. So in countries that are planning to achieve universal health coverage by 2020, you realize that the percentage of their health expenditure per capita that is contributed by the private sector out of pocket is dropping. Ghana's is going up, and is going to go up again in 2024 based on the budget itself.